What interested me from the beginning, which I never really was interested in other fields when I went to medical school, is that the brain is not like the rest of the body. You get a cut in your arm or your leg and it heals. With the brain, you get a cut, the brain doesn't recover. And so what I like about the whole aspect of neurosurgery is that the cases, when you do the surgeries, it's very intricate and you got to be very delicate and very careful, otherwise you can cause injury. And so that's why I kind of like it. In terms of the actual technical aspect of the field, it's a very small percentage. The procedures, that we typically do are 1 to 3 hours, 4 at the most. So most of your time is spent spending time with the family and the patients, trying to comfort them, to kind of convince them that everything will end up being okay. It is. That's probably 90% of my job is managing the kind of the non-surgical things and the dilemmas that occur with each patient. I'll tell you, every patient that I see, I give them my own personal cell phone, so they can reach me any time of the day, and I'm always there if they need something, or if they have a question, or they're confused, or they're worried. The technology has changed so much that patients who potentially 10, 15 years ago wouldn't come out of the hospital alive, walk out of the hospital a day later. So what I like about the group is that we get guys who come from all top institutions, and so the variability of the care that the patient's going to receive is pretty similar. So if I go away for a week, my patient's in the hospital, I know that the patient's going to get the same care that I would give them if one of my partners was seeing the patient.